Welcome to Straight Back Talk, a podcast where I cut through confusion, bust myths, and give you the unfiltered truth about your neck pain, back pain, your disc injuries, how to get you to live a healthy, pain-free life non-surgically, help you make the best choices possible if you do need surgery for your spine. I'm Dr. Jeffrey Garofalo, a practicing chiropractor of 23 years with extra certifications in spinal biomechanical engineering. I have a mini fellowship in neuroradiology and electrodiagnostics. I am published in the National Institute of Health and am a candidate for a fellowship in primary spine care. I've also written this book right there, Never Look Back, a simple guide to the causes and care for back pain to do just that, help you move forward when it comes to neck pain, back pain, disc injuries to live a healthy, happy life. Let's jump into today's topic. We've got a great podcast for you. It's going to be a wonderful one. I've got a lot of notes prepared. I'm ready. I'm excited. Today's topic: 3 reasons why back and neck pain are very common in today's society. So gang, there are 3 major reasons why neck pain and back pain are very common. Now, there's a difference between common and normal. Is it normal to have back pain or neck pain? No, it's not normal, but is it common? Yes. It's like cancer. Is cancer normal? No, but is it common? Yes. So it's very common to have neck and back pain, and I want to share with you the 3 reasons why you're having chronic neck and back pain. We want to show you the physiology of that, go to the research, and then talk about what it's actually doing to society and why we might be making the wrong decision. So let's jump into the 3 reasons. Number 1 reason you're having back pain consistently is from bending and lifting improperly. Number 1 cause of pressure on a spinal disc improper is bending, lifting, and twisting. So let's talk about why that is. Let's show you in our model here why that is. Let's talk about the structures that are being impacted, why they cause pain, and then we'll move into the next one. So bending, lifting, and twisting, number 1 cause of serious back problems. Why? Because we affect multiple things. The first thing we're going to affect is this red thing here called the disc. The disc is a gel-like or water balloon-like with jelly in the middle. You think of the outer part of this disc as its concentric circles of tough cartilage, but think of it like a water balloon because when you squeeze, it compresses and it pushes pressure in different directions. The center part of the disc has like a hard round shell with a gel-like substance in the middle that absorbs pressure and disperses the pressure around the concentric circle equally so that the tough cartilage absorbs pressure, it contracts, and then it expands to push the pressure back out. So it's designed to have all of the pressure put in the center and dispersed equally around the circle. Problem is when you bend and lift, you bend improperly with weight. When you bend from your low back improperly, you start to squeeze the disc at the front part and you put pressure in the front, not in the center. As you put pressure in the front, think of it as a water balloon, now I start to push the pressure out the back, and that is where we start to injure discs. Now, many people believe that if a disc isn't injured enough, as big enough type of injury, or it isn't pushing into a nerve, it isn't a problem. But that's not true because the outer 2/3 of this disc, concentric circles, has a nerve touches it called the sinovertebral nerve or the recurrent meningeal nerve. And when you stretch the fibers, those nerves become sensitive and they can cause what's called discogenic pain. So the first structure that can be injured is called the disc. When you bend, you're squeezing it, the pressure goes where it doesn't belong. You start to stretch the fibers and the nerves say, whoa, 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 stop, and start letting the brain know, hey, we've got a problem here. So the first tissue that's damaged when you bend and lift improperly consistently is the disc. The second is going to be these joints right here. These are called the facet joints. And what these joints do is they're supposed to hold pressure and then they come up and they allow just the right amount of spinal movement. But there are ligaments. There's a capsule around here. When I say capsule, you think saran wrap wrapping around the joints of cartilage called a capsule. And it only will go up and stretch so far and then contract. And when you stretch this capsule or the ligaments by constantly bending, you're overstretching the ligaments. When you overstretch them, they have nerve endings in them like the disc, and they will alert the brain to say, hey, we're damaging ourselves here. And when you repeat that bending, lifting with pressure, you're overstretching these ligaments right here, called the facet capsule. And when you overstretch them, you damage a ligament. You sprain a ligament, grade 1, 2, or you tear it at grade 3. So if you're repetitively bending and lifting improperly without using your legs, and you're constantly bending and lifting improperly, well, then that's a problem, because you're going to constantly stretch the joints. And when you stretch the joints, you're going to stretch the ligaments, and you're going to have repeated chronic sprains of the ligament, and that will cause chronic damage and chronic pain. The third part is obviously ligaments from this bone. Obviously, this is a capsule or a joint with a ligament, and then the ligaments from this bone to this bone. The ligaments called the transverse process. These transverse process have ligaments, and when you constantly stretch and you bend and twist, you're again stretching these ligaments past their normal range of motion, called their normal physiological range. What is physiological range? Very simple. If, I'm not telling you to do this, but if you were to take your finger and bend it back, you're going to lock at a certain point. If we keep going, you're passing your physiological norm, and then you're going to break the joint. So what happens is with ligaments, you can pass their physiological norm, the joint and the capsule, and then the ligaments here. And when you go past their normal range of motion or end range, now you start to chronically damage the ligaments, causing pain. You've got muscles from here to here, here to here, in between here, all around. And when you, again, chronically bend and lift, you are overstretching those muscles. And when you overstretch those muscles, now you start to create strains of the muscle, grade 1, 2, or 3. Muscles have nerve attachment. And when you damage the muscle enough through straining it, again, you cause chronic pain. You cause chronic weakness. You cause chronic damage to muscles when you bend, lift, and twist improperly. Bending, lifting, and twisting, again, will also damage muscles. When you damage muscles, you're going to have chronic pain. And the last one, again, are nerves. When you chronically or constantly bend and lift improperly, we talk about the disc being a water balloon, you will push the disc backwards, and you can push the disc into these nerves right here. And when you push the disc into the nerve, you can create pain down an arm or down a leg. It's called a radiculopathy. Chronic pain or weakness down an arm or a leg from the disc pushing on the nerve. Why? You're bending improperly, you're pushing the pressure backwards, and you're constantly weakening the disc. It changes shape, called morphology. It pushes into a nerve, and now we've got chronic pain down an arm or a leg. So improper bending and lifting will create damage to those areas of your spine, creating long-term chronic damage, creating long-term chronic pain. That's the first way that you create chronic neck pain and chronic back pain. The second way is sitting. There's research that came out in about 2017 that said sitting is the new smoking. Why? Because when you chronically sit, most often the core muscles don't engage in the bottom part here, and you start to slump your pelvis, and then the head comes forward, and we start to slump like this. And when we slump, we lose the proper normal C-shaped curve that should be in the back that opens to the rear end, and the same C-shaped curve in the lower back. That C-shaped curve puts proper amount of pressure on the joints and the disc. And when you start to slouch, it's almost like bending improperly. You start to shift forward, and when you shift forward and then your head comes forward, we'll talk in a moment, For every inch the head comes forward of the shoulders and hips, the head weighs an additional 10 pounds on the discs. So the same type of motion happens when we start to sit too long, we start to lean forward and our shoulders come forward, our head comes forward. It's like chronically bending over. You start to damage the disc, the joints, the ligaments, the muscles, and the nerves. So when you sit too long, if you don't hold proper posture with your shoulders back and your head back and upright position with your core, it's almost as if you're bending over chronically and constantly, and you're going to constantly start to injure those same type of structures. So sitting, you sit for about 15 minutes, up to 30 minutes max, try to hold your posture, and then you get up and move around and you do it again. Pay attention to head position, shoulder position, and core position. So again, in a future podcast, we're going to talk about showing you really exactly what to do as far as bending, lifting, and twisting, what to do, what not to do as far as sitting. This topic is all about the structures being injured, and is the exact same structures as when you're bending over and lifting improperly. So bending, lifting improperly, number 1. 2 is sitting improperly. And 3 is, where is the position of your head and neck? Meaning, when we sit, we come forward. When we read, we come forward. When we look at our phones, when we're sitting at our computer, head position will determine proper spinal alignment, joint, and disc. How should we hold our head? Well, we should hold our head upright. And when our head is upright, we put a normal C-shaped, banana-shaped curve in the neck that brings the head over the shoulders and hips. When the head comes over the shoulders and hips, the head weighs exactly 10 pounds. You lock the joints together properly. You put the proper amount of pressure on the joints and in the center of the disc, and the discs and all the structures are perfect. When you chronically and constantly look down, doing work, hammering, sewing, working in the kitchen, you're reading your books down, looking at your phone, your computer, when the head goes down, the head starts to come forward of the shoulders and hips. And for every inch the head comes forward, the head weighs an additional 10 pounds. So if we measure on our x-ray in our office that your head's come forward 1 full inch, it means your head went from 10 pounds, now it weighs 20 pounds. Well, that 20 pounds starts to put pressure in the front part, the spine tilts the wrong way, and from the top to the bottom, you start compressing discs, mislining the spine from top to bottom, and it starts to injure the same structures. So as you can see, we're talking about spinal biomechanics and injuring the same structures by the habits that you create. See, we focus a lot on the symptoms, but we don't focus on the habits that create the damage. So bending, lifting, and twisting improperly, sitting improperly for too long and improper, and then the last thing is paying attention to your head position. These are the 3 top reasons why you will have chronic neck and low back pain. And the thing is, when I say chronic meaning long term. You see, we say chronic pain is pain that lasts in an area of your neck or low back, in our world, greater than 6 months. If you have chronic neck and back pain greater than 6 months, it's considered chronic, and chronic pain is a major problem in this country. Why? Because people are addicted to medications, they're addicted to opiates, because we're only looking at the pain. We're not looking at the habits or the structures, we're looking at the pain in this country. And here's the problem. Chronic pain leads to irritability, depression, and it leads to suicide, it leads to breakup in relationships, it leads to poor parenting, it leads to lots of problems. Let's talk about some studies that show that chronic pain is a problem, right? So let's talk about this. So chronic pain and depression. There's a comprehensive study out of the Journal of American Medical Association, Network Open, analyzed data from 376 studies involving over 347,000 individuals across 50 countries. The finding revealed that approximately 40% of adults with chronic pain experience clinically significant depression, with higher prevalent rates among women, younger adults, and individuals with fibromyalgia. The rate is notably higher. It's just insane. It's notably higher. Chronic pain creates massive amounts of depression. Research published in Frontiers in Psychiatry indicates that irritability accounts for 40.7 to 65.5% of the effect of chronic pain on depression. It suggests that irritability is a substantial mediator between chronic pain and depressive symptoms. Wow. Institute for Chronic Pain notes that depression can lower an individual's frustration tolerance, leading to increased irritability and difficulty coping with pain. It is a vicious cycle. Pain, depression, irritability. Chronic pain leads to depression, which turns into lower pain tolerance. Depression increases irritability, which can exacerbate the perception of pain. And irritability and depression can impair social interactions and coping mechanisms, further intensifying the experience of chronic pain. It is a vicious cycle. Your habits are creating damaged tissue. We're not looking at the damaged tissue, we're looking at the symptom, and then we're treating the symptom. The problem is your depression, your irritability is related to habits and damaged tissue, and we're solely focusing on the symptom and not the damaged structure or the habits. We're medicating and we're creating lots of problems in the world. For example, if you had a pebble in your shoe and you had pain in the foot and I said, hey, just take ibuprofen all day long, it wouldn't make sense, right? You'd say, look, why do I have the pain? Diagnose the fact that there's a pebble in the shoe, and oh, that's a mechanical problem. Take the pebble out, not just say, oh, there's pain, give medication, right? So that's a problem in our country today, is we're not identifying the cause of the pain. A, the habits, B, the structures. So in our office, we look and we diagnose, we have such a high success rate because we're looking at habits, structurally, biomechanical engineering, habits creating damaged tissue, and then we want to know what tissue is damaged, creating the pain you have. That's why in our office, all of our new patients have x-rays from top to bottom. We want to know the neck position, the joints, what's the rotation of the pelvis. We want to know what structures are damaged, from x-rays to deep consultation to palpation to orthopedic testing to MRI analysis. Deep testing to find out what structures are involved in your pain-causing process and what habits do we need to change. And that's why we have such a high success rate. Nobody's looking at the habits or the structures, we're just treating pain, right? And that's the problem. Let's talk about topic number 2, which is leading right into this. Testing, and don't fall into the MRI trap. Okay, what's the MRI trap? Well, a couple things. Number one, there is research out there to show that if your practitioner, chiropractor, medical doctor, whoever, is only reading the report from the MRI, there is a 43.6% error rate. That's the first trap. The first trap is, there's a study done that showed that a single patient went to 10 different imaging centers, all who had different types of quality of MRI, and then they tested the radiologist, and they discovered, long of the short of this study is that there is a 43.6% error rate in the type of reading or expression of results, or the radiologist giving you your results. So in other words, if it's a general radiologist, they have a 43.6% error rate reading your MRIs. What's a general radiologist? Somebody who reads your MRI and says, today I read brain, then I read shoulder, then I read arms, then I read feet, then I read spine. General, right? Jack of all trades, master of none. There's a 43.6% error rate in reporting your MRI results, compared to a neuroradiologist who has about a 5% error rate, right? So the first trap is this: if your practitioner does not put the CD into the computer, pull up the images, and know how to study and read all of the images, and you're only getting your information off of the report from the doctor, your chiropractor, your physical therapist, your medical doctor, there's a chance that you're missing 43.6% of the information that could help you diagnose the problem and solve the problem. Like, for example, in our office, I have a mini fellowship in neuroradiology. So I started reading my own MRIs with the gentleman who helped the two gentlemen developed protocols for MRI at the State University of New York on Long Island. This is where MRI was developed. In 2013, I started studying with the gentleman who helped him, and I've read thousands and thousands of MRI. I've got a mini fellowship in reading MRI, and I'm constantly improving my skills, and so are my doctors. So we don't just read reports, we look at the films and we study the films ourselves. So be careful if you have an MRI and the doctor is only reading the report to you. If it was done by a general radiologist, there's a 43.6% error rate. That's a trap. You might not know your full diagnosis. Therefore, you're going to affect your outcomes and your treatment plan. Second trap. Never treat an image. In other words, don't let your practitioner, whether it's chiropractor, medical doctor, orthopedic, physical therapist, treat the image on the film only. In other words, in our office, you, the patient, give us deep clinical information that we ask for to try to match up what we see damage-wise on the MRI with your symptoms, because the size of the herniation doesn't matter. We have seen huge herniations not be the problem, and small little herniations where the orthopedic surgeon says, nah, that's not a problem at all, I wouldn't be worried about that, cause major pain. And I'm talking in our office, reading the MRI, connecting it, saying, look, that herniation there is really large, but that's not your pain generator. Your pain generator, with our history and our palpation and our examination, shows it's the one below that, and it's a bulging disc, or it's a small herniation. But we never say, hey, that's the big one, work on that, that's the small one, leave that alone. We've had plenty of times where we've seen large herniations not be the problem, small herniations or bulges be the problem. Attack that level, treat that level, get that level to repair itself, and the patient has phenomenal results. And we've seen where, ooh, man, that is a large herniation, it is the problem, but you cannot just treat off of an image. You have to put the whole picture together. So never assume a small problem doesn't cause the problem and a big problem is the problem. Never treat off of an image depending upon size or type of damage. Always connect, there's damage there, whether it's big or small in the orthopedic or the medical doctor or the chiropractor's mind, with your level of symptoms. We've seen too many times where it's been rubbed off, pushed off, well, that's not a problem, come to us for a second opinion. We go, well, there's a problem there and it matches up with the level. We're gonna treat that and the patient gets phenomenal results. So don't just treat off of images, treat off of the full picture. Your history, your examination, your x-rays, combined with symptoms, combined with the MRI. So never, 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 never allow the practitioner to just treat off of an image. That is a big mistake. That is a trap. Treat the person and use the image as a tool. So, 2 topics we've talked about so far: why you've got chronic neck and back pain and the MRI trap. What I'd like to do is share with you a case history of a real live patient, because this might be you. And so let's talk about this. Sheila K, came to our office with chronic neck pain into her shoulder, into her arm. We did a consultation with her. During the consultation, we looked at her x-rays. We saw there was decay and degeneration in her lower neck. We did our testing and said, look, we think you have a disc injury. She said, yes, I've been told that. I brought my MRI. She brought her MRI. We studied her x-rays. We studied her examination. We said, we think you've got a cervical 5 and 6 disc injury based on the x-rays, based on what we saw on the MRI. There was a herniation there. It was on her left side. It correlated with some shoulder pain she was having. So we sat across from her and said, okay, here's the care plan. Here's what we're thinking. And she started to cry. And I said, Sheila, why are you crying? She said, Dr. Jeff, I've wasted a ton of money at other chiropractor offices trying to get my disc fixed, and they're just treating and treating and treating. I said, well, let me ask you, when you first went in, did they recommend an MRI? No, I had to suggest an MRI just a couple weeks ago. I said, so you've been treating for months and months and months with no MRI, and you had to recommend the MRI and you just got it. I said, that tells me that they were treating with their eyes closed or blind. How do they know what they're treating, right? You close your eyes, you shoot at a target. You don't do that. You look at the target. So I said, so they started treating you. You've spent thousands of dollars and you had to recommend the MRI, and just now they're correlating it. I said, well, that's a problem. I said, because they could have been treating the wrong segment, wrong area. And she said, okay, well, I'm really nervous to start anything. I spent thousands and thousands of dollars. I said, look, let's take it slow. Here's your care plan. In our office, we have so much data and research, I can give you a prognosis. Your doctor should be able to give you a prognosis, meaning they can look into the future based on the care that they've given over thousands of times and say, here's what we expect. So I said, look, we expect a 20 to 40% improvement based on thousands of pieces of research that comes back to from our patients in the first 12 treatments. So let's do a short-term care plan. If we're there, we get to move forward. If not, we get to change and move. So she started care, and my doctors were doing a great job with her. And about visit 9, I get to see her, and I'm in the room with her, and she's smiling. I said, Sheila, you're smiling. Yeah, your customer service is phenomenal. Your team is making me feel great. My neck feels great. My arm feels great. I said, you're smiling. I said, but there's a but. She said, yes. I said, what's the but? This was like on a Thursday. What's the but? She said, well, I'm nervous to go home now and start using my arm and my neck, doing chores and whatnot, because I'm scared of the pain. I said, here's the deal. We're getting to visit 12 real soon here. I want you to go home this weekend. I want you to do everything you want to do. She said, really? I said, everything, and then report back to me on Monday. So she goes home. She comes back on Monday, and she says, my neck feels great. It hasn't felt this great in such a long time. But, I said, what's the but? She said, my arm is killing me. I said, okay. Well, tell me about that. So, well, I went to reach and do that. I said, no, stop. Say that again. Your neck feels great, but you went to reach and use and paint and this. I said, Sheila, I think you also potentially have a shoulder rotator cuff injury. She said, really? Because I've been trying to tell people that and they're not listening to me. I said, sit down. I said, hold on. A lot of times a disc injury can act like a shoulder injury, and a shoulder injury can cause neck pain. So I said, hold on, sit down, let's do an examination. So I did some testing for her rotator cuff. Now, that's not my area of expertise, but being a spinal expert non-surgically and a chiropractor, and this is all we focus on is disc injuries, you start to see patterns. You start to say, okay, we know how to recognize the shoulder, neck, hip labrum, L5, so we start to recognize this after being an expert for so long. And I started doing my test, and I said, based on your pain levels, based on the touch, based on the test, I think you have a rotator cuff injury. Would you be willing to go for an MRI of your shoulder? She said, I want to do that. I've been telling the other chiropractors for so long. I said, you have a shoulder injury. I think it's appearing that way. Long story short, we sent her for an MRI the next day. Within 12 hours, it came back that she had complete tears and a labrum issue. So sent it to our non-surgical expert. He said, no, not for me. Sent her to the surgeon, the guy we work with. She was so happy. We are now almost 2.5, 3 months post-surgery, and her arm feels great. Her neck feels great. She is so happy because we listened. We're experts at what we do. We do nothing but spinal disc injuries and spine. As chiropractic experts, we discovered and diagnosed shoulder. She feels neck pain is gone, shoulder pain is gone, and she is completely happy. We do this stuff all the time. We diagnose, we prognose, treatment plan, and then we work with other doctors to get you the results you're looking for. And Sheila couldn't be happier today. She's so happy with our clinic. She's telling everybody about us. And so we are super excited for diagnosing spinal disc injury, half the battle, and then shoulder, other half. Had we just done one and not the other, she'd still have pain today. So that is our purpose. Diagnose, give you a prognosis and a great treatment plan, working with other team members to get you the final relief, because we're identifying structures that are injured, patterns that are causing injury, and solving it non-surgically. And when we need surgery, we can do that as well. Well, gang, if you've enjoyed today's podcast, I appreciate you being here. Please do me a favor. Hit the like button, hit the subscribe button, and if you've got friends or family that you need to hear this or see this, please let them know about this, refer them to our podcast. And if you'd like more free resources and education like this, go to drjeffgarofalo.com. DRJEFFGAROFALO.com, where you can get more free resources, tools, and things just like this. It's been great having you here on the podcast today. Cannot wait for next episode. This is Dr. Jeff. I'll see you next episode.